Hello, my name is David Duffy. I am a retired physician. I want to share with you some more healing thoughts. This is our 23rd episode, and we're going to talk about pseudo-healing. In self-reliant medicine, we want to go deeper into the cause of the problem and discover ways to really improve our health. I wouldn't say exactly a cure, but to be able to know what to do with symptoms and what they signify. Let's take diabetes as an example. Pretend you have diabetes and you are going to the bathroom frequently, you're thirsty, you feel tired, your blood sugar is high, and you go to the doctor or emergency room and you're told this is diabetes and they're going to give you insulin. And you take insulin or a pill that works like that, and lo and behold, you feel better. Your symptoms are gone. You don't have thirst. Your blood sugar is normal or near normal. Is that healing? Not exactly. That is control of the symptoms, which should not be confused with healing. Let's think about diabetes. What goes into diabetes? There's a genetic tendency, so you're born with that. But if you have diabetes as a baby, why does it start to be symptomatic 30 years later or 40 years later? What happens? Well, your metabolism is having difficulty with carbohydrate metabolism. Your body handles carbohydrate by depositing it as fat. So over time, you gradually gain weight. Now, your pancreas has beta cells that make insulin. And when your sugar goes up and your body increases the insulin, the blood sugar is okay. It's under control, and you don't have diabetes symptoms for many years. What happens? Well, that extra strain on the pancreas is compounded with something called insulin resistance. The heavier you get, the less effective the insulin is. So in order to keep the sugar down, you need to have more and more insulin pumped out. But your pancreas kind of wears out. It can't keep up with the demand, and that's when you become symptomatic. In order to really control this, you need to, while you're taking the insulin and controlling it that way, you need to seek ways to improve your metabolism, really improve the diabetes. So what does that mean? For instance, you have been for years in the habit of eating white bread and donuts and things like that, and you have a sweet tooth and things like that. Can you really change your diet? Can you cut back on the starch and substitute fruits, vegetables, salads? Okay. Can you change your lifestyle in ways that only you can discover? That's what self-reliant medicine is all about. Now let's talk about some standardized treatments. When you have a headache, you commonly take aspirin or Advil or Aleve. Those are all anti-inflammatory medications which reduce pain. However, inflammation is the healing process. Therefore, in taking the medicine to help you feel better, you're really delaying the healing process. Now that's perhaps you have a headache because you're tired, you haven't eaten in a long time, you're under stress, whatever. Yes, you can get the pain relief temporarily, but eventually it goes away because you get a night's sleep or whatever. Similar with muscle pain. You've strained your muscles, you over-exercise, and you take those pain medicines to feel better. And you're told by advertisements that, you know, why bother with pain? You should take it. But really, that's not allowing the sore muscles to rest and repair themselves. Okay, now let's talk about the patterns of medication. Why do medicines work? What do they really do? There are several categories of medication function. The first category is medication that has a stimulating effect. When you are depressed, there's a medicine called Zoloft, and one of the neurotransmitters in your brain is called serotonin. And when the nerve secretes it and it affects the next nerve and goes through the cycle, the metabolism, you know, takes the leftovers and absorbs it. The medicine called Zoloft is going to inhibit the reuptake of the serotonin and have more serotonin available to your brain, and that appears to relieve the depression, or at least give some improvement. So that's where a medicine is leading to a stimulation. Epinephrine is another example of a stimulating medicine. A person who has an allergic reaction that is swelling up and gasping for breath, they're given a shot of epinephrine or adrenaline, and the swelling caused by dilating blood vessels is inhibited because the epinephrine causes constriction of the blood vessels and relieves the allergic reaction. It similarly has a stimulating effect to open the lungs, the bronchodilator function, to relieve asthma. The second kind of medicine is a suppressive medicine, and we already alluded to that with aspirin, Advil, Aleve, where you're suppressing inflammation in that case. Now, the third type of medicine we call the destruction medicine. An antibiotic kills the bacteria, or at least stops them from growing. Chemotherapy, cancer therapy, kills the cancer cells and sometimes some of the normal cells too. So we're destroying. Similarly with radiation therapy, when you put a radiation beam and it hits the nucleus, it can knock out the replication function of the DNA. Okay. If you have warts, there's a liquid that you put on a wart that has a high concentration of salicylic acid, and that basically clumps the protein in the cells and kills the cells. Okay. Another type is a replacement type of medicine. Now, we already alluded to that. Your body doesn't have enough insulin, so you take insulin. Your body doesn't have enough thyroid, so you take thyroid hormone. Your body doesn't have enough cortisol, so you take a steroid medicine to replace that. Another type of healing process, quote unquote, is what I call a diversionary tactic. Okay, when you have backache, what do you take? You know, simple over-the-counter medicine. You take Bengay, which has menthol. So you rub Bengay over the sore muscle, and the menthol is an irritant that takes the attention of the nerves and has a pain relieving effect. It diverts the attention of the nerves away from the pain. Some people with chronic pain put an electrical patch on it, and that's called TENS unit, a transcutaneous electrical nerve stimulation. Again, that is an electrical stimulation that takes the attention away from the pain and makes you feel better. You may feel better, but you are not yet better. Now, how do we deal with our illness in terms of talking with the doctor? Medicine has standard treatment programs. You know, this is the treatment for that. This is everybody. The doctors in the medical school and are trained to treat a strep throat with penicillin or ampicillin, and they, you know, if this happens, you do this. If that happens, you do this, and that's a very professional, sophisticated approach. I mean, there's a huge amount of information that doctors absorb and use on a day-to-day level, and that's wonderful. That's very good. They do well with that. Now, if you go to the doctor and they give you, this is the treatment, and you say, well, but what's causing the symptoms? Why do I do this? They're not too anxious to talk about that. They may not have time. They may not know. Many of the diseases, we don't really know the cause. We know that the symptoms are this. These medicines suppress the symptoms or help the symptoms. And you know, if you have diabetes, you should not eat so much candy. And you know, if you have a heart condition, you should cut down on cholesterol, those kind of things. But basically, it's take this medicine and you'll feel better. A self-reliant medicine patient is interested in doing more. And when you ask what's the underlying problem, what is the body asking for, what is your body crying out for, that's when we really need to work on our own. And a common sense approach is that when you have a minor symptom and it's chronic, you can think of ways to solve the problem. When you eat a certain food that causes indigestion, what was that food? What was the circumstances? And then you say, hey, maybe I should stop eating that. Maybe I should stop doing that. And when you do, guess what? Your body feels better. And when we discover those things, we need to profile ourselves. We need to discover what are the boundaries of our lifestyle in terms of our body. We're all born with weaknesses. We have, embarrassing things that we're feel bad about and stuff like that. And that's personal. And what I want people to do is become medical research associates and participate in your medical care. You're not becoming a doctor on yourself. You're going to go to the doctor and you're going to have proper care, but you're going to ask and act upon questions that make sense to improve your health, and you're not to be afraid to experiment in terms of learning self-control, improving your lifestyle, making changes in your diet that make sense to you, all of those things. And when your creative, inquisitive part of you is advocating your health and the health of your family, you can learn from that experience and benefit from it. Now, I want to talk a little bit about immunosuppressive therapy. There are some major diseases that are very devastating and have now been treated with medicines that suppress your immune system. Now, my feeling is that the immune system is really the housekeeping component of your body rather than the policeman. Okay, now, rheumatoid arthritis is a disease in which your immune system is attacking or causing inflammation in the joints. Psoriasis is a disease where the skin gets thick and itchy, and they believe that the immune system is stimulating the cells to grow and prematurely the maturation is speeded up, so the skin gets thicker and thicker, and this has to do with the immune system stimulating that inflammatory part in your skin. Another immune disease is called lupus, where you could get problems in the lungs, problems in the joints, problems in the kidneys. Now, there are new medications called immunosuppressive medications that are really antibodies against the immune system, okay? And in psoriasis and rheumatoid arthritis, there's one particular called infliximab. And it goes against the what they call tumor necrosis factor, which causes inflammation. Now, you hear that, you see that on television, everything is wonderful. You see me, you can, the psoriasis patient can go out with the short sleeve shirt on because they're not having inflammation. It's wonderful and it's miraculous. And the rheumatoid arthritis patient can now, play tennis and stuff like this and can be normal, and that's wonderful. But what's going on here? What is exactly happening? when you block the immune system, it is not able to do its function to clean out or respond to what is accumulating in that part of the body. If you inhibit the disposal of garbage in one part of the body, it can collect in another part of the body. In other words, you're like kicking the can down the road. You have a mess here, and we're going to block that, so there's a mess on the other side. Or you can have a mess in your kidney and in your lungs and in your skin and in your nerves, whatever. And if you read the side effects of this infliximab, it's very interesting. It can lead to serious infections. Now, if you accumulate garbage, we know the number one is to have an infection to eat it up. Number two, a person who's had hepatitis B and is fine, when they take this medicine that suppresses the immune system, hepatitis can be reactivated. Okay. There is a chance that you will get leukemia or lymphoma, tumors of your blood cells, the T-cell lymphoma. And another one is where you have a disease in the brain called demyelination of the nerves, where there's nerve damage. And of course, that's serious. So you may need to take some immunosuppressive therapy, particularly in a serious disease, but we really want to minimize that medication and give it, try to decompress, clean out your immune system and your body to prevent something that's worse than the disease you're treating. The average person has not had any medical training. Why is it that in the past, mother was the primary care physician for her children and her family? She had common sense. She listened to the body intuitively. She prayed and got inspiration to respond to the needs of her children and to herself and to her husband, whatever. And I believe that in medicine, we need to get to do more of that. We need to do research to show that this person with this kind of diagnosis, this kind of disease, this kind of limitation, when they do this, they get sick. But if they do that, it helps. It might even cure them. The trick is that this can't be standardized. This cannot be monetized. We're not looking for a treatment for everybody that you go online and get a brochure and start taking. The commercialization of treatment is not the answer because we are unique. You need to figure out for yourself what works for you and take charge of that. We want you to be able to discover ways of losing weight, eating the right amount of food, avoiding constipation, sleeping better, cutting down on your allergies, being better in shape in terms of athletically, all those kind of everyday today symptoms that modern medicine really, you're not sick enough to need that. Just take a medicine, you'll feel better. But if that's the symptom, that is a clue to leading to a more serious disease in the future. We want to nip it in the bud. And we want to get patients to ask questions, to make changes, and figure out what you did that made improvement, and then communicate that with your doctor the next time you see them. I recommend keeping a little notebook in terms of your discoveries and stuff like this. This is you're not being paid. This is not a big deal, but it's a personal participation in your own health, so that the lessons learned about what your body needs and how best to take care of it, you have a handle on. You feel good about. You know what's good for you more than the doctor knows. Okay, so this concludes our discussion today. I hope that's stimulating to you. The next time we're going to kind of go have an overview. We will have a total of 24 presentations in this series. So we will kind of take an overview of self-reliant medicine and some of these things for next time. And good night.